We all have a lot to consider when it comes to health and wealth. Please stay tuned and listen to two gentlemen today talk about health and wealth. Greetings, Matt and Craig. I'm so thrilled to have both of you here today. We have so many questions and so much information to share with people. We're thrilled with some of the research that ARP and others have done that shows that the fastest growing age is those people who are 80, 85 years and older. That's good news. Yay. That means more pickleball, more talks with grandchildren, more proms for watching, taking pictures of grandchildren going to proms and all that good stuff. What we also know, though, right, is that people aren't planning to live that long. They're not making the necessary plans early enough. And everyone, wishes that they had some planning opportunities earlier, both in terms of health and in terms of wealth and how they connect those two and as it relates to healthcare in particular. So we're going to talk about that today. And we're so happy to have you all with us to share that information with us. So let's just start a little bit about talking with both of you about what you do. So Matt, why don't you go first? What do you do and what services do you offer? And then Craig, you can follow up on that. So people have an understanding of who you are exactly and what you do.
Sure, thank you. So our business is Oasis Senior Advisors of Mid-Michigan, and we're here to help seniors and their families navigate the various senior living options, whether that's planning for a transition to assisted living or trying to find resources in the case of dementia, which we call memory care, or even just being a resource for seniors and their families to help find the right solutions, navigating veterans aid and attendance and all the complexities around trying to find the right long-term plan. So our service is free to seniors and their families, so there's no cost to consult with us. And so we really enjoy helping everyone.
I mean, we don't even hear that word very much anymore, free. That's incredible. And so people need to make certain that they have a plan and that they know what's available to them. So Craig, tell us what you do.
Well, my official title, I'm managing director over at Ameriprise Financial, run a team over there with two other advisors and two assistants, but we're in the financial planning process. So many of our clients have been working for 20, 30, 40 years, and in many aspects plan to be retired for 20, 30, 40 years. So there's a lot of planning that goes into that. And so from that process and then going to implementing, we'd bring someone in like Matt, for example, to kind of talk about some of the dynamics that we're not experts in. So we would go through and draw on different specialists in particular areas, and then quite frankly, learn of the whole gambit of what goes on so we can apply it for other clients' situations. But it's that aspect of planning today, tomorrow, and several days and years into the future.
You said something there, you said a lot, which was very helpful, but you also, I took note of the fact that people are living 30, 40 years beyond their retirement. And
Yep.
that's huge, so we look at our little nest egg and think, okay, I can make it, this much each year, this much each year. And then things happen, healthcare happens, loved one
Yep.
gets, things happen. So what are some either, both of you can take this, what are some of the common mistakes that you see people make?
That's a great question. One is always thinking that retirement is, well, I'm done. I'm not going to work anymore. And just from that aspect is you sit there and think, well, it takes work to travel. It takes work to go out and visit with family. Retirement's not what it used to be. There's a lot of activity. I've got clients retiring in their early 50s. And why? Because they've been working at some places for 30 years. 30 or 40 years, and they can retire and they start a second career. So what does that mean for and another aspect of it, people that are retiring in their 40s and 50s still have their parents who are in their 80s. So we're in that area of having a sandwich generation to where they still have kids themselves that are going through college, caring for their elderly parents who are still very active themselves in some areas of society, and many wanting to start a second career. So it's been very particular there of, okay, what do we do to plan for what those desires are? And that's where it's been rather enlightening for me is when I talk with the different clients, understand what their different goals are. All right, we need to start planning. And it doesn't mean if a person is 55 or 60 years old that they stop planning. It's probably, if I can go, they stop that planning process because they think, we've reached the end game. But that just means, no, you're just in a new chapter that's going to go for another 10, 15, 20, maybe even 30 years out yet. So what do we do going forward from here?
That's a really good advice because it's not just even about paying your expenses from year to year, having the money to do that, but it's also how you want to live the quality of your life. And that also relates directly to the quality of your health. and
Yep.
making certain you have the kind of plans in place, or you even know what the options are, right? For
Yep.
just in case you need to be a caregiver to someone. And so, Matt, what are you seeing as some of the common mistakes?
Well, yeah, I think it's interesting in that most of us are pretty well, or at least better at planning on the financial side of things. And Craig may disagree with me, but most of us don't think of the healthcare side of things with our plan. And the reality is that 50% of those seniors that you mentioned earlier, Paula, are going to need some level of support. And often it's help with the daily tasks that we talk about, or assistance with daily living. That's dressing, getting in and out of the bathroom, transitioning from maybe a wheelchair to standing, all of those things. The reality is we're going to need help with those things at some point in our life. So what's the plan? Do you plan on hiring someone to come into the home to do that? And there's a certain budget that should be considered for that. Do you plan to use a family member to do that? And are they aware of that? We talk with a lot of seniors that say, I don't want to be a burden to my children. I don't want them to have that sort of responsibility. So let's just have open plans and communication to plan for the health side of things in retirement.
And that's, we don't want to think about that. But at what age would you suggest people start thinking about that for both the financial side and the health side, the wealth and the health? What age should they?
I would say it's never too early to start. There's no downside in starting now to have the conversation with either professionals or family members or whoever you counsel with on these kind of matters. It could be a spiritual leader or a financial planner or somebody like us, because the number one thing we often hear is, I wish I would have started talking to you sooner. And so I would say it's never too early to start.
And what about on the wealth side, Craig? Same thing, same message?
Same message. When we sit down and talk about it, I mean, a lot of things that Matt have talked about is our topics of conversation that we have with clients is directly that, even in the formation of trust, because sometimes when you're looking at Medicare and Medicaid planning, how some of these services that are going to get paid for. And sometimes there's a 3-year leadway, a 5-year leadway that has to be done financially that allows for these payments to be made. Quite frankly, even having conversations with kids, sometimes you can set up a structure. If people are trying to look for ways of being able to transfer wealth from one generation to the next, and what the responsibilities are from executors of estates to who do you want to have as powers of attorney, medical powers of attorney, all of those dynamics, for example, to write contracts for caretakers that come into the house. If you have a family member who's had a stroke or has had an unexpected circumstance, we need to be prepared for those situations. So this way, a family member can sign on the behalf of that individual. And, you just like what Matt was talking about, you have people who are going to be needing assistance. We have family members in our family that we started planning probably 10 years ago for the aspect of unexpected circumstances that happen even within our own household. So from that dynamic, I never stress that it's too early to talk with clients about planning for the inevitable, because everything that Matt was just addressing is, those are in many circumstances unexpected. Aging, that is something that is to be expected. We know that our bodies are going to deteriorate over time. And so that aspect of knowing when you first start to retire, you want to go do the things you couldn't do while you're working, because we know 5, 10, 15 years later, all right, we've done the things that we wanted to do. Now we're going to start to slow down just a little bit. And then that slowing down starts to say, well, okay, what's the next step? What's the next phase? How do I want to spend time with my family?
Yeah, and be careful about assumptions too, right? I would say a lot of people assume that Medicare is going to cover something, or they're going to assume, hey, I've got a long-term care policy and it's going to cover certain things. And be careful about that. Take the time to understand what's going to be covered and what's not, because reality is Medicare does not cover many of the things we're talking about, and you're left to fund those things on your own. So be careful with assumptions as well, is what I would add.
Absolutely.
Point. There's what you're saying about the planning, for long-term care, and whether it's insurance or financial planning, however you do that. Then there are the people who want to take care of their loved ones in their own home. And that's expensive sometimes as well. It means, you have to have someone coming in, there's expense attached to it, no matter how you proceed, right? And if you have someone coming into your home as a care provider to a loved one, but they've been making that decision about, do I want someone to come in? There's a sense of responsibility for some of us anyway, for family, that we want to take care of our own family. There's a burden on us when we do that as well. Having that extra help, coming into the home a couple of days a week, or the extra money to have someone come to the home a few days a week, should also be part of the consideration that people have as they begin to plan for the future. Talk to us about that.
Yeah, we take a very personal approach, as I'm sure Craig does as well, and because everybody is different and every situation is different, and every individual can change over time as your financial situation changes, as your healthcare situation changes. It's likely that the plans need to change. So in many cases, having someone come into the home for a certain period of time is absolutely the right decision. But as things change and that frequency of in-home care lengthens, and you're talking about maybe 24-hour in-home person, that can become very expensive and maybe not the best choice. So there's always opportunities to reevaluate the plan as well. So start early and keep that plan fresh.
Yep.
Is there such, and I think I know the answer to this, but for those who may not, people can plan for long-term care separately from their own investment or their nest egg. There's separate ways to do that, right? For their own health.
Yeah, when people think of long-term care, they initially automatically tie it to insurance in some areas, and some clients are very well of being able to fund it. For example, some of the average costs of a long-term care facility can be anywhere from $5,000 to $10,000 a month. So and that can be completely inclusive depending on the amenities that one is needing or the level of care that is required. So they'll have medical facilities that are already in particular places to be able to meet those needs. So we basically evaluate as a worst case scenario on what a client's portfolio might be able to do. And then if their portfolio can't manage that, just use this as an example. If a person were to transition into a long-term care facility, then they're not going to need to pay on property taxes. They're not going to be able to need to pay for other daily expenses because all of that has been bundled into a long-term care facility. So we basically evaluate what those costs might be and what their portfolios can handle going forward. The tricky part is that transition period. And just like what Matt was talking about, having a caretaker either work from, maybe just needing to alleviate the family member from, the family may take care of the aging parent during the day, and then may bring in a caretaker just for the evening care, just in case someone needs to get up in the evening, and that helps to give that time period. And then the expansion and making that the house prepared for aging in place. And so making those areas of adjustments. Doesn't make sense to completely build a whole new house. I have clients who are doing that. I have ones that are just doing additions onto a home. I have ones that are just making the minor modifications in their house. And understanding what that total cost is going to be. And there are builders out there that specialize in aging in place, that take a look at what are those specific needs. And Matt, I would imagine, has more of that area and even that network of who are these builders, who can they reach out to, and that's where you really start to gauge what are the overall expenses, what are the extremes from the level of care that someone needs to the full level of care that may have difficulties just getting around. So,
and that's one of the advantages that a transition to an assisted living community will bring. They're already built with these universal design concepts in place: wider hallways, lever doors as opposed to knobs, grab bars throughout. So certainly modifying a home or building a new home is a great choice. But that's where the benefit to transitioning to an independent living or assisted living community may be the best option.
Mm-hmm. We talk about universal living, and ARP is a big proponent of that as well. Not only for older adults, but for younger adults as well. When you have a couple of children, you've got a carriage that you're pushing, or it's slip and slide in the restroom. So designing a home doesn't have to mean that you wait till you're retiring and then start putting that handbars and stuff up in the restroom, but they're good for all ages. So just a little side note for people there. It doesn't mean we walk into a place and they have the handbars in the shower, or they have some kind of protection in the restroom so you don't slip and slide, or adjusted toilets or whatever. It doesn't mean that they're old. It just means
make it easier.
It makes it easier. Exactly.
Right.
Exactly. So again, the universal design and housing is really important for that. What are you seeing? What do people how do people prepare to come to you? What do they say? What do they need to bring? Do they just call, not just to you specifically, but to, to an advisor for financial or health issues? What do they need to bring? What do they need to have prepared? Their finances, their W-2s, their health care wishes, or what do they need?
And the conversations that I have with clients basically starts off as at a 30,000 mile view. So we don't get into actual particulars as it relates to what their overall income is and what their needs are. We look at what their sources of income are, such as Social Security, if they're getting a pension, if they're receiving a certain amount of income, if they have required minimum distributions, if they're already at that point within IRA assets. And then we look at some of their non-qualified assets that they have outstanding. Do they have income generating properties? Because that becomes an issue too. If they do, for an older generation, how are they transitioning from that level of income? And if we end up start looking at selling some of those properties, what do we do in order to supplement some of that income? So do we start looking at some of the long-term care insurance and utilize the proceeds from the sale of a property to offset some of that? So it's really personalized on sitting down with the individual, and it all starts with that 30,000 mile view and get an understanding of what are your goals. I mean, we hear that it's kind of very cliche-ish. What are your goals? What do you want to do with your money? It's a matter of, well, what do you need it to do, and how do we go about making sure that those needs meet up with what you want to do and how you want to live during your retirement. And one other just component that I kind of add to the conversation with clients is even trying to prepare a younger family, and I say younger family, 50s, 60s, living with their older generation. I says, well, it's kind of like having a thing of roses. You have something that's really beautiful on the outside, but every now and again, there's a thorn on the inside. And so there's some emotional preparation that takes place because we sit there and think about it. I know, Paul, we've talked about it before. Some of the best wealth transfer isn't necessarily of money. It's of the knowledge that one generation can pass on to the next, and the ability of being able to live in a close-knit community. There's some pros to it and there's some cons as it relates to a family structure, and just making sure that families and all the different generations are prepared for it, not only financially but also socially and mentally, and prepared along those lines.
Well said. Generational wealth means nothing if you don't have someone who has character, integrity, and knows the values of life and has memories about family. Just spoiled brat is what you end up with. Matt, what do they come to you?
I think I would add that, we are also certified senior advisors. And so in that, it, I guess, best translates to, we're going to be working in your best interest. So we take a very personal approach, just as Craig mentioned. We're not just going to offer you a phone book style listing of options for you. We're going to take the time to really understand what are your level of care needs and what is your budget. And that way we can make the best recommendations for you. So just be prepared to have open and honest conversations with us. When you work with professionals like us, we're all honoring HIPAA agreements. Everything is confidential. We're not going to share any information without your consent, but we need to understand what your level of care needs are and what your financial situation is so we can make the right choice.
I'm almost getting emotional thinking about the service that you all provide. People, I just hope they pay attention to this. It's never too early. Most of the times it's too late, as you mentioned before, for people to come. But think about that. We're all going to be aging. How do you want to age? And having those goals, even the medical profession now talks about what are your goals in life? If you break an arm, what are your goals? What do you want to be able to do? So it's not cliche at all, but it's a part of who we are. So we've got about a minute left. So each of you take about 30 seconds and give us some closing comments.
The one thing, if I may, is just kind of address what we talked about even kind of before we got into the conversation, was a lot of folks feel like they have to do it alone. Whether it's the kids as a part of the conversation or the parents. And either speaking with myself or Matt, we're here so this way they don't have to have that feeling of doing all of this alone, making these decisions and understand what their options are.
Exactly. Help us, let us leverage our information and our resources and go to work for you.
Well, thank you so much for the work that you do. I appreciate you all so very, very much. Thank you. And hopefully, ladies and gentlemen, that's news that you can use. Sam, welcome back. We always appreciate you being here. What are the most frequently or commonly asked questions when people talk about retrofitting their homes so they can live in it as long as possible?
Well, Paula, thank you for having me back. And I love this question. And it's not because the questions they ask me, it's more of the comment they respond to is indicating they don't need this yet. And so my question to them is, when do you need it? After you have an accident? You know, you put your safety belt on your car before you have the accident to be safe. You know, and look at it the same way with your home. Install the grab bars today. Don't wait till you have the accident and then put them in. It's sort of backwards. So the other thing is, you want to make sure when you install grab bars that you have a professional that comes in and takes care of that. You know, you want ADA compliant grab bars. There's specifications for that. The other thing is, you know, entering and exiting the house. You have rails to walk up the stairs or walk down them. You know, those are other areas where accidents do occur. But the bottom line is, bring in a professional that knows and understands that environment, that deals with the aging in place, and that can handle those kind of questions for you. That would be my top recommendation.
And some people look at those things as, you know, those are old people items, you know, but even for children, for young folks who have children, or if you break a leg or you have a temporary setback, everything that you just mentioned really helps.
Oh, absolutely. I have grab bars in my bathroom. I know I'm a little bit older, but I've had it in there for quite a while. And we use them all the time. It's just like handrails going up and down stairs. Make sure there's one on each side, but have a handrail. A lot of stairs do not have handrails, like steps outside, that really you should have them.
Thank you, Sam. Appreciate that information. Welcome, Dr. Al Schwab. So nice to have you with us. You know, so many people we hear are suffering from gout. Tell us a little bit about gout, what it is, and what are some of the risk factors?
Okay. So gout is, as you said, is the most common cause of inflammatory arthritis. It's a condition that happens because of the position of uric crystal in the tissues. And it's usually manifest by severe joint pain and swelling. Patient feels like their foot is broken. Even touching the bed sheets will be very painful. So this is a painful condition that can be recurrent in the beginning as an episode, and eventually it becomes chronic if left untreated. So people ask why they're getting gout, what's the risk factor for gout? And the most important risk factor is the uric acid. When you don't have gout unless you have high uric acid. So this is the most common risk factor. Other risk factors are gender, like male get it more than female. They get it at earlier age if they're overweight. Of course, if they have family history, it's very important. People who have family history of gout are more susceptible to have gout. And people who consume high fructose diet, like soft drinks and something sweet in those, and some medication, of course, have an effect on this. So these are the main risk factors. And then these risk factors will put you at risk for gout. Does not mean that you necessarily have gout. There's some trigger that can trigger gout attack. And the most common trigger is excessive consumption of alcohol, dehydration. There are people who are at stress, like if they have surgery, if they're in the hospital. Some medications can also can be a risk factor for triggering a gout attack. I just want to mention one thing is sometimes people want to lose weight and they go on high protein diet, and that sometimes can be a triggering factor. So people who wants to start this diet, they have to consult with their physician before starting this diet to make sure that they're not at risk to have developed gout.
Excellent advice. Thank you, Dr. Al Schwab. Hopefully, folks, that's news that you can use. Now go take on today. Craig, thank you for being here. Let's talk a little bit about people who retired, who wish they hadn't retired just yet and kind of maybe want to do something else. What are some options for people to add to their income or just to add to their social life?
Well, it's it's a wonderful dynamic and conversation that I have with a lot of different clients. You have I have from the spectrum, some clients are going to want to go on vacations. And so in the first 3, 4, 5 years, they'll go and do what they want to do. They've traveled the world. They visited, the 7 wonders or 12 wonders or 15 wonders of the world, however many there are presently. But then when they get back, they're like, okay, I've done this, I've done that. But I've always wanted to kind of run a business or run a store and some dynamic along those lines. And that always becomes more fun because there's a lot of cost that jumps into it. And then there's other factors that play into it, such as what we've been experiencing. I have had several clients who have transitioned into retirements over this last year and then gone through the process of starting a business. So markets start to come down during the first quarter of the COVID. All right. So if they're funding their business and then all of a sudden we have policies to where if they're in a retail type business, their business structure went down. We had to plan for a lot of those unexpected events, but it is and adds some excitement to their lives because they are focused on providing a level of service to their client, to the customer, and to make it through and plan with clients as the things are adjusting and changing. That is kind of a dynamic that I've really enjoyed in working with clients because every client's been a little bit different. The financial situation has been a little bit different, but it does add a little spark in their retirement to do something that's a little bit different than what they've been accustomed to for the maybe previous 30 or 40 years.
Thank you. So again, once again, Craig, lots of good information, and thank you for being here today. Appreciate you.
Thank you very much, Paul. Appreciate being here. Thank you. Bye-bye.
Matt, people are living longer than ever, which is the good news, but they're not always planning for that long life, that longevity, particularly as it relates to assisted living and long-term care. What should people do and how do they prepare to be able to afford long-term care?
Yeah, that's a great question. And in most cases, your long-term care is really up to you in terms of the cost that covers it. Many people are surprised to learn that Medicare does not cover most of your long-term care expenses. For the most part, we're all on our own, or what we call private pay. But there are a number of options that can help. There's long-term care insurance or very specific products like reverse mortgages or life settlement options for those holding life insurance policy. But for the most part, it requires some planning because you'll be relying on your individual income from Social Security, pensions, and retirement savings.
And people, because they're getting older and they may need some help with activities of daily living, some of the simple things, doesn't mean that they're not going to still have their independence. There's still a lot you can do if you're in assisted living. There's still a lot you can do to maintain some level of independence in assisted living.
That's right. You still have the independence to come and go as you'd like. Many assisted living residents can still drive. You're able to keep your own physician and maintain some levels of independence for sure.
And you may not want to go live with your children, even though some people think that's an option. They may not want to do that.
That's right. Consider all of those options, though, as you're planning your long-term care needs, is who are you going to rely on? Is it going to be a family member? Have those discussions now and plan ahead and think about your long-term care needs.
Because we want people to live their best life as they age. So thank you so much, Matt. Good advice. Appreciate you being here. We appreciate you being here today. We hope this information has helped you plan for your future. Thank you for watching Real Possibilities.